Hello, everyone. I am Antonella Cardone, the CEO of Cancer Patients Europe, and I am presenting today on behalf of COVID Community Council. Here are my disclosures that you can read relating to this presentation and event. I would like to begin by recognizing the members of the COVID Community Council, including 8 leaders representing patient and citizen organizations with a focus or interest in COVID-19, and extend my gratitude to Pfizer for sponsoring this important initiative. Altogether, we aim to advocate for and amplify the voices of medically vulnerable populations in programs that address the community's needs. The Global COVID Community Council was established to co-create innovative strategies aimed at tackling the challenges COVID-19 continues to pose for medically vulnerable people and to advocate for equitable access to COVID-19 prevention, treatment, and care. The Council unites leading patient and citizen organizations for Europe, North America, and the UK, representing communities impacted by conditions such as cancer, kidney disease, myalgic encephalomyelitis, and those who are immunocompromised, as well as caregivers. Our diverse perspectives and experiences allow us to identify and develop evidence-based, culturally appropriate and context-specific priorities and solutions, ensuring public health measures are inclusive and beneficial for all. Between December 2021 and April 2022, global COVID-19 testing rates dropped significantly. A year later, in May 2023, the World Health Organization declared that COVID-19 no longer constituted a global health emergency, marking the symbolic end of the pandemic for governments, healthcare institutions, and the wider population. While this announcement brought hope and relief to many, COVID-19 continues to pose a significant threat to medically vulnerable populations, such as individuals undergoing cancer treatment or living with HIV, who remain at increased risk of hospitalization and mortality due to deficient responses to COVID-19 vaccines. Further, beyond the general recommendations of mask wearing and routine vaccination, there is a notable gap in global and national health guidelines and policies regarding COVID-19 testing, treatment, and protective measures tailored to medically vulnerable populations, their families, and caregivers. This gap limits the focus on strategies to effectively prevent infections in these groups. This lack of guidance, along with a shortage of trusted resources, creates inconsistencies, confusion, and the spread of misinformation, all of which contribute to poor health literacy. As a result, these individuals continue to live in constant fear of contracting COVID-19, with many still shielding themselves 4 years after the start of the pandemic began. This prolonged isolation has taken an inevitable toll on their mental well-being. So, while the rest of the world has moved on from the pandemic, insufficient access to up-to-date practical guidance, general pandemic-related fatigue, and the lack of understanding and awareness of long COVID-19 have left many medically vulnerable groups feeling isolated, disempowered, and anxious. While it is clear that COVID-19 continues to have a widespread impact on medically vulnerable communities, studies maintain a backward look at the pandemic, and surveys tend to focus on condition-specific or regional population data, limiting our understanding of the broader current challenges these communities face. This leaves significant gaps in available research exploring the global impact of COVID-19 on medically vulnerable populations, particularly following the Omicron variant. In response to these gaps, the Council has united to raise awareness and seek innovative solutions to address the ongoing health challenges faced by medically vulnerable populations in the post-pandemic era. The Council is committed to gaining a deeper understanding of how COVID-19 continues to affect the daily lives and mental well-being of these communities and their caregivers to drive meaningful change. Key priorities include raising public and healthcare professionals' awareness of the ongoing burden of COVID-19 on medically vulnerable groups, developing tangible outputs to inform policies addressing health inequities and improving access to mental health care. Since October 2023, the Council has held 3 virtual meetings following a structured process that included preparatory work, planning, discussions, polling, and a literature review. This groundwork paved the way for a global patient survey addressing the data gaps in COVID-19 care post-Omicron. During our meetings, we identified key barriers to COVID-19 testing, examined the mental health impacts on medically vulnerable populations and caregivers, outlined several priorities for solutions that call for action to address these challenges, and reached a consensus on an effective framework for a global patient survey. I will be sharing the outputs of these meetings today. During our first Council meeting, we identified 7 key barriers to COVID-19 testing, including cost, accessibility, authorization and distribution of tests, variety and accuracy of tests, lack of guidance and on actions required following a positive test, education and awareness around vaccination and treatment, and COVID-19 testing fatigue. The findings from a literature review conducted after this meeting closely aligned with the barriers and experiences shared by the Council. The literature further highlighted a significant gap in both global and national directives on strategies for COVID-19 testing, treatment, and prevention. Current published guidance focuses primarily on universal measures such as mask wearing and routine vaccination, particularly for individuals with the pre-existing health conditions and their families. The Council also agreed that the impact of COVID-19 on the mental well-being of medically vulnerable communities was extensive, affecting 5 key areas: patients, their families, friends and caregivers, societal stigma, healthcare services, and the dissemination of information around perceived burden and risk. The literature on COVID-19 and mental well-being emphasizes the severe consequences of lockdown measures, social isolation, loneliness, and the experience of surviving COVID-19. Collectively, these factors have contributed to what experts now refer to as a secondary pandemic, marked by a significant increase in mental health issues. This surge includes conditions such as depression, anxiety, post-traumatic stress disorder, increased feelings of loneliness, and even suicidal thoughts and behaviors. It was also observed that much of the discourse within the literature tends to focus more on retrospectively analyzing the pandemic rather than proactively suggesting solutions for the ongoing challenges posed by COVID-19, which has now become an endemic respiratory disease. The barriers in the COVID-19 testing pathway and the virus's impact on mental well-being, as identified through council discussions and reinforced by literature review, largely arise from a lack of clear and cohesive public health guidance, specifically directed towards healthcare providers and medically vulnerable populations. In response, the Council evaluated 5 tools and interventions from the literature to develop a call to action aimed at addressing these barriers to COVID-19 testing and mitigating the virus's impact on mental health. As representatives of global patient and citizen organizations, we centered our experiences and the populations we serve in this project, advocating for comprehensive solutions rooted in coordinated, reliable, and uniform public health directives. These directives must offer clear and easily understandable information tailored to diverse audiences, including individuals with long COVID-19, the medically vulnerable, and their families and caregivers. It is essential that COVID-19 guidance addresses the unmet needs of these populations and drives the development of strategies that effectively address the mental health issues stemming from COVID-19. We call for the empowerment and better protection of medically vulnerable communities by gaining global commitment from all stakeholders, including patients, healthcare professionals, pharmacists, policymakers, and the general public, in the creation and delivery of education programs. These programs should focus on raising awareness and understanding of COVID-19 prevention, vaccination, testing, and treatment, while also promoting mental well-being among those most at risk. We have submitted a publication of our findings in a peer-reviewed journal to advocate for optimized care and good health and well-being for all. Building on this work to date, the Council has since launched a global patient survey to quantify the impact of COVID-19 on medically vulnerable populations. This survey aimed to address gaps in knowledge and gain insights into the attitudes and practices of medically vulnerable populations since the pandemic. Collectively, the Council agreed that applying the knowledge, attitudes, and practices, so the KAP approach across 3 key themes, current risk management, strategies, impact, and treatment, provided a strong framework for gaining insights into the ongoing impact of COVID-19 on the daily lives and mental well-being of the medically vulnerable. By addressing these research gaps, we hope to build awareness, guide future initiatives, and drive the implementation of meaningful changes to better support medically vulnerable individuals worldwide. We seek to publish the results of this survey to promote a greater awareness of the ongoing impact of COVID-19 on the medically vulnerable.